Today, we will be covering the topic on dementia. The learning objectives are as shown in the slides. We hope that by the end of the lesson, you will be able to define dementia, understand the different types and list the risk factors for dementia, know what are the signs and symptoms, as well as the critical issues of dementia, list factors that can help in the prevention of dementia, and finally, use the abbreviated mental test to assess the elderly for features of dementia. What is dementia? Dementia is defined as an acquired progressive decline in cognition involving at least one cognitive domain that interferes with independence in everyday activities. This is irreversible and symptoms will gradually worsen. How common is dementia? Currently, 1 in 10 people aged above 60 in Singapore has dementia, and half of those above 85 have it. You may be thinking, then what about people who do not fulfill the criteria for dementia but seem to have some cognitive decline? Now, that is a good question. So this group of people are said to have mild cognitive impairment, and I'll be explaining more in the next slide. There are 6 cognitive domains which I'll be going through with you. This is based on the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, in short, the DSM-5. The first cognitive domain is learning and memory, followed by executive function, complex attention, perceptual motor, language, and social cognition. Any changes or decline in any of these domains may indicate cognitive impairments and may warrant further investigations. For each domain, I'll be sharing with you some examples of symptoms or observations that relate to that particular domain, and we'll split it into mild and major symptoms. The first domain is learning and memory. Elderly with mild symptoms may have difficulty recalling recent events and will rely more on list making or calendar. They may also lose track of whether bills have already been paid. More serious symptoms could include repetition in conversations, often within the same conversation. Some may not be able to keep track of short lists of items when shopping, while some may require frequent reminders. Moving on, the second domain is executive function. For elderly with mild symptoms, they may require increased effort to complete multi-stage projects which involve organizing, planning, or making decisions. They may also encounter difficulty in multitasking or difficulty resuming a task after being interrupted. For elderly with more severe symptoms, they may abandon complex projects. For this group of individuals whose executive function are affected, they will eventually have an increased reliance on others to plan instrumental activities of daily living or make decisions on their behalf. The third domain is complex attention. For mild symptoms, normal tasks may take longer to complete as compared to before. Thinking is easier when not competing with other stimuli like television or background noises. For major symptoms, the elderly may have increased difficulty in environments with multiple stimuli and may be easily distracted by competing events such as television or conversations. They may also have difficulty holding new information or repeating what was just mentioned. The fourth domain is a perceptual motor domain. Mild symptoms may involve reliance on maps or others for directions. Some may find themselves lost when not concentrating on the task. If the elderly can drive, they may be less precise in parking. Whereas for some elderly, they may expend greater efforts for spatial tasks such as carpentry, assembly, or knitting. Major symptoms include having significant difficulties with previously familiar activities, such as using tools or driving motor vehicles. Some may also encounter difficulty in navigating familiar environments. Elderly are also more confused at dusk. when shadows and lowering levels of light can change perceptions. The fifth domain is language. Mild symptoms include difficulty in finding the right words to say. Some elderly may substitute general for specific terms, while some may avoid use of specific names of acquaintances. Major symptoms include having significant difficulties understanding others and expressing themselves, whereas some may not even recall names of closer friends and family. The last domain is social cognition. For elderly with mild symptoms, they may have subtle changes in their behaviors or attitudes. This may be reflected by a poorer ability to recognize social cues or read facial expressions. Some may have decreased empathy or apathy too. For elderly with more severe symptoms, they may behave inappropriately in a social setting, usually out of socially acceptable standards. They may show insensitivity to social standards of modesty or of political, religious, or sexual topics of conversations. Also, some may dress inappropriately for weather or social setting. Here is a diagram to better illustrate the progression from normal aging to dementia. The y-axis represents cognitive decline, while the x-axis represents time in years. The green arrow depicts normal aging, where everyone experiences slight cognitive decline as we age. Now, we focus our attention to the preclinical phase. This is a silent phase where the brain changes without measurable symptoms. Individuals may notice changes, but these are not detectable on tests. Next, we go on to MCI, which means mild cognitive impairments. These cognitive changes become more apparent to the individual, family members, and people around them. Though one or more cognitive domains are impaired significantly, they are still able to perform activities of daily living. As the individual declines further, they are said to have dementia, where at least one of the cognitive domains are affected, and it becomes severe to the point that it interferes with daily living. Now, think back to the first module. Can you name the different BADLs and IADLs? Before we go on, can you still remember how many cognitive domains are there? And what are the cognitive domains? Feel free to pause the video and think through it. To answer the questions, there are 6 cognitive domains, and they are learning and memory, executive function, complex attention, perceptual motor, language, and social cognition. Kudos to you if you got it all correct. Moving on, we will be talking about dementia mimics. The first thing most people would associate with dementia is memory loss. But does memory loss necessarily equate to dementia? Maybe not. In this table, we see 5 causes of memory loss and the specific symptoms and examples of these causes. Again, for normal aging, cognitive function remains relatively stable and there are none or mild personality changes. For this group of older adults, verbal and handwritten notes may be helpful. So, next time, before we say that memory loss is a result of dementia, we need to think of other factors that can also cause loss of memory. Now, we will go through the common types of dementia. The most common cause of dementia is Alzheimer's disease. It has been shown that clumps of protein, called beta-amyloid and tau, can cause damage to healthy nerve cells and fibers connecting them. The second most common cause of dementia is vascular dementia. This is caused by reduced blood flow to various parts of the brain, thereby depriving the brain of oxygen and causing death of brain cells. Next up, we have Lewy body dementia. This is associated with abnormal clumps of protein, causing damage to the brain cells as time progresses. The last 2 types of dementia that I would like to share are mixed dementia and frontotemporal dementia. As the name suggests, mixed dementia means that more than one type of dementia is occurring in the brain. For example, the presence of both Alzheimer's disease and vascular dementia can occur in an elderly. Frontotemporal dementia is characterized by the degeneration of neurons and connections in the frontal and temporal lobes of the brain. You can reference the photo in the slide to see where the different lobes are situated in the brain. For frontotemporal dementia, the two affected lobes are the one in red and green. The frontal lobe of the brain is vital in higher level of executive function, and these include problem solving, speech and language production, regulation of emotions and mood, voluntary movements, memory, and attention. On the other hand, the function of temporal lobe revolves around auditory stimuli, emotion, memory, learning, and motivation. Thus, the signs and symptoms of frontotemporal dementia manifest in the loss of function of what was mentioned earlier. To give you an example, an elderly may have problems remembering things, have changes in his or her mood or behavior, or they are not able to understand or express oneself. Having gone through the slides, we now know that dementia is not just about forgetfulness, but it has a debilitating effect that can interfere with activities of daily living. Remember the slide on the progression of aging? While it is normal to experience age-related cognitive changes, dementia is not part and parcel of old age. Though dementia is a progressive disease, there are still some things that can be done to help slow down the progression of dementia. Early diagnosis provides a better chance of benefiting from treatment. Individuals are affected by dementia differently, and here are some of the signs and symptoms of dementia that an individual may experience. Some may have difficulty retaining new information, so for example, someone with dementia may keep asking you the same question in the same setting, like, "Have you eaten?" They also tend to be more forgetful and may experience memory loss. Some have difficulty with coordination or motor skills. Tasks like buttoning their shirt or tying their shoelaces become increasingly difficult to complete. Some may have changes in behavior, where one may become increasingly agitated or aggressive. Or they can be anxious or depressed too. Some may have difficulty in communication. Either they are unable to comprehend what was spoken, or they can't find the words to express themselves. Some may have poor organizational and reasoning skills, and may encounter problems in handling complex or familiar tasks. For example, some people may forget how to drive or forget how to cook their favorite recipes. Now, we will be going through the risk factors for dementia, and they have been split into non-modifiable and modifiable risk factors. Some non-modifiable risk factors include age, persons with Down syndrome, and family history of dementia. The modifiable risk factors include smoking and our common chronic conditions like diabetes, high cholesterol, and high blood pressure. Unhealthy diet and lack of exercise have been shown to increase the risk of developing dementia. Also, research has shown that people with abnormal thyroid levels, low vitamin D, vitamin B6, vitamin B12 levels in the blood are more likely to develop dementia. Diagnosing dementia requires a comprehensive assessment by the doctor. This usually involves history taking from both the patient and a close family member or friend. Cognitive tests such as mental status examination and abbreviated mental tests are conducted. As mentioned earlier, depression can be a dementia mimic. Thus, it is also important to screen for depression. PHQ-2 and PHQ-9 are validated tools to screen for depression. This is an example of PHQ-2 screening instrument. Should an individual score more than 3 points, it is considered a positive result. In this case, PHQ-9, which is a more comprehensive tool, should be utilized. We can use the abbreviated mental test, in short AMT, to assess if the elderly has dementia. There are 10 questions in total. Each correct answer will give a score of 1. A score of 6 or less is suggestive of delirium or dementia. Further tests are then necessary to confirm the diagnosis. To further evaluate for dementia, physical and neurological examinations will be conducted by the doctor. Lab tests will also be sent. By now, you would already know what deficiencies can increase the risk of developing dementia. Finally, neurological imaging, such as CT and MRI brain, may be done when there is an acute onset of cognitive impairment or suspicion of brain bleed. PET scans may also be done to diagnose dementia. There are some critical issues that come along with dementia. As mentioned earlier, an individual will experience gradual deterioration in activities of daily living. Usually, their IADLs will be affected first, followed by BADLs. Some individuals may experience behavioral issues such as delusion of theft and sundowning, where they become more confused and may become more aggressive or agitated in the late afternoon or nighttime. Some may also display socially unacceptable behaviors such as exhibitionism. Lastly, caregiver burnout is very common because it can be physically and mentally tiring to be constantly looking out and caring for someone with dementia. Remember one of the misconceptions mentioned earlier about how nothing can be done to help someone with dementia? Here are some ways to help slow down the progression of dementia, and these include smoking cessation, exercising regularly, having a healthy and balanced diet, engaging in conversations and challenging activities such as solving puzzles, reducing alcohol intake, and taking medications. Other management include taking medications to slow down the progression of dementia. As mentioned earlier, some demented individuals may experience behavioral changes such as increased agitation or aggression. So, it is important to identify and manage behavioral problems and meet their needs. Oftentimes, those caring for persons with dementia are at risk of getting caregiver burnout. Thus, it is necessary to provide caregiver support whenever necessary. In conclusion, dementia is an acquired progressive decline in cognition involving at least one cognitive domain that interferes with independence in everyday activities. The progression of dementia in an older adult can be slowed down by engaging in regular exercise and challenging activities, having a well-balanced diet, reducing alcohol intake, smoking cessation, and taking medications. AMT can be used to assess for cognitive impairments in an elderly, and further tests can be conducted to confirm diagnosis. Here are some reflective questions that you can think about in your own time. Thank you very much for your time, and we hope that you have learned something from this lecture. To consolidate your knowledge, please scan the QR code and attempt the quiz. Alternatively, you can access the quiz using the link shown in the slide. Once again, Thank you for your attention, and we hope that you have learned something from this lecture.